Hi, I'm Dr. Mike Datola, and I'd like to welcome you to this episode of Inside Dentistry's Product Talk. We are virtually on location in Irvine, California with Dr. Rod Kurthy, and we are here with him today to talk about the KoR Whitening system, which Rod created. It feels like over 20, 25 years ago. So, Rod, thank you for taking some time out of your busy schedule to speak with us today.
Well, I've been looking forward to this, Mike. You know, you and I used to hang out a lot back in the day, but it seems as of recent years, we just haven't had a chance.
Well, I feel the same way about my kids, Rod, and I don't know. That just seems sometimes how life seems to go along. But yeah, I mean, I remember 25, 30 years ago getting to know each other on Dental Town, and I have to say, you've been the most singularly obsessed dentist that I can think of off the top of my head. It's always been you and vital bleaching. You had this attraction to it early on, and it became your obsession to create a system that would give us the results that dentists have always craved, and I think the patients have always deserved. Tell me a little bit about where that obsession for you started.
Well, actually, I never had a particular obsession with whitening per se until I had one particular patient. I had a patient years ago before there was such a term as extreme makeovers, and I did an extreme makeover on her basically. Did lots of veneers, and she loved that. And she told me that she had a daughter who had very discolored teeth that no one was able to fix at all. She said, "Oh, she has never had a cavity. She had ortho, etc." So she wanted to pay to have her daughter come and have all these veneers. Her daughter lived an hour and a half away, and her daughter came in with the strangest appearance I have ever seen. She had a background color of A2, and 60% of the surface was a Hershey bar chocolate brown. And so,
Wow.
you know, my first study in teeth whitening was 1977. So I think I've probably been at it longer than anybody else on the planet. But so I had a lot of knowledge at that time. And this was in the later 90s, probably. And I said, give me 2 weeks. And to go back through all the science in my head, I came up with a particular technique for her. Because I wanted to whiten her as much as possible so that I could make the veneers as translucent as possible, you know, the routine. And
Sure.
son of a gun, we whitened her to a Hollywood white, no specks of brown, and I freaked out. I was like, what have I created here? And just fine-tuned it over the years. And, you know, you saw in the early days when I was posting all the results on Dental Town, and that just morphed into
Exactly.
whitening.
And I think as dental professionals, we've been taught, I don't know if we've been taught, but at least marketing departments have kind of told us that, the only difference between whitening gels is what percentage you want to use. And the higher percentage, the faster you'll get a result. And many of us has found that that's not necessarily true, but it certainly can cause more post-effort sensitivity while the patient's using them. The difference between KoR and other whitening products are there's a lot of little differences, some bigger differences that really make it a completely different product. I want to hit on a few of those. The
Okay,
first
sure.
is the refrigeration. From the time you guys manufacture it until it gets to the dental office, it's refrigerated. Tell me why that's so important.
Well, this is something that I've theoretically been a fanatic about for years, but not owning a whitening company, I couldn't do it. Peroxides, all type of peroxides are unstable chemicals. That's good and bad. It's good because it can break down in your mouth and create bleaching factors and whiten the teeth. But it's bad in that without refrigeration, the gel, the peroxides start to break down instantly upon manufacture. Then when they're in warm warehouses or in hot UPS trucks, which can go up to 160 degrees Fahrenheit, they start breaking down. And so by the time the dentist would get them normally, they'd be about 20% of the original effectiveness. And so you would have to put in chemical stabilizers. Well, that's a double-edged sword, because if you put too much chemical stabilizer in there, when the patient uses it, it won't work. And then if you put less in there, it only helps a little bit, preventing it from breaking down. So the key with refrigeration is it stops the breakdown. It virtually prevents it. And so we don't need to put the typical chemical stabilizers such as phosphoric acid and anhydrous bases in our products. And so when the dentists get them, not only are they at the original effectiveness of the day they were manufactured, but there's no phosphoric acid or anhydrous base to slow the breakdown. So when you put them on the teeth, they go crazy. They are just incredibly effective. So that's why the refrigeration is important. And also, one other very important thing is that those chemical stabilizers, phosphoric acid and anhydrous bases, will raise the osmolality of the gel as much as 11 times. That's 11 times more pull on the dental tubular fluid, 11 times more discomfort. So by not having those chemical stabilizers in, we have the lowest possible osmolality, the least pull possible on the dental tubular fluid, and therefore the least amount of sensitivity. So refrigeration is important for a lot of things.
Yeah, and it's not just a matter of ordering your whitening gel from whoever and then sticking in the fridge, because obviously at that point it hasn't been cold the entire time, and it's also got these additives that, as you said, create more post-operative sensitivity. Another thing that you learned, I think, early on was that saliva and sulcular fluids tend to work against you when you're trying to whiten the teeth, and as a result, you've actually created your own line of whitening trays to slow this down or eliminate this as much as you can and get better results. Tell me a little about the KoR Lab and the trays that you guys make.
Well, it was always frustrating. I'm sure everybody watching this has heard the studies done by Dr. Gordon Christensen and others, including myself, that show that typical custom whitening trays made at labs or made in the dental office, when you place the whitening gels in there, regardless of whether you're sleeping with them or not at night or wearing them during the day, the studies are showing that they're only significantly active for between 20 to 30 minutes in the middle third of the tooth. And what's interesting is the saliva and sulcular fluid. It has an antioxidant enzyme called glutathione peroxidase that is intended to destroy peroxide, and it will destroy carbon white peroxide, hydrogen peroxide, you name it, on contact. And so one of the interesting things is, where does it start to leak first? In the gingival third there. And where do dentists lots of times have patients complaining, why is it still yellow, yellow up at my gum line? Well, that's one of the reasons. Of course, thinner enamel, et cetera, can cause that a little bit, but primarily it's the fact that that gel was destroyed within a couple minutes. So I created in my mind a tray that could actually seal out the sulcular fluid and seal out the saliva. And gosh, I did that just for my own practice probably 25 years ago, Mike. And so in my own practice, I was using that, and that hasn't changed. And so and by doing this, it fits so well that patients come in laughing, and they'll say, a couple mornings I woke up and started eating my breakfast or drinking my coffee before I remembered the trays were in my mouth. So they don't, the patients don't feel that yucky gel swallowing, because it's pretty much sealed in, and they fit like crown and bridge, so they get used to them. So let's put it this way, the trays are what allowed me to create everything else. Everything else, the whole system is based on the fit of the trays, and the trays, these particular trays, instead of being active for only 20 to 30 minutes, they're active 6+ hours with some activity out to 10 hours. So when patients sleep with it, and of course during sleep you're not swallowing much and you're not salivating much, they're getting 6+ hours of effectiveness compared to only 20 to 30 minutes. So that allowed us to do a lot of things.
That's amazing. And so if you go to KoR Whitening, if you're a dentist and you see the before and afters that are on there, they look very dramatic. In fact, they're so dramatic compared to regular vital bleaching cases that you probably say, I'm not sure those look real. Something looks off about it because it was so effective, and we're just not used to seeing that. And I know that you can't pick and choose piecemeal from this. You need to use the fully refrigerated KoR Whitening system in conjunction with the trays if you expect to get results like that. And that leads me to my last question, Rod. If you do look at the before and afters on the website, you might think, oh, this is just something that's supposed to be used for really dramatic cases. And that's probably because most of the before and afters you see there are very dramatic because it shows how well that KoR works. But I have the feeling you feel that this is more of a product for everyday whitening and not just these extreme cases.
Well, it is, Mike. We have tons of different kits. So for instance, when you have a patient with certain expectations or a certain type of case, fluorosis or dentinogenesis imperfecta or tetracycline or whatever, we have specific kits, and you can always consult with our staff to see what you need. But here's the interesting thing that I always knew, because I published 2 books on marketing. And basically that's how to get good patients and how to turn those patients into patients who will say yes. So when a patient comes into our offices and say they want white teeth, this is the color they want. And because we think of white as, not really white, but they're not only wanting, but they're expecting white teeth. And if they get something less than what they're thinking, number one, they're not as impressed with the dental office or the dentist. Their friends don't notice it as much. After a couple of days, they have forgotten all about it. But one of the things that I found in my practice, and we get dentists telling us this on the phone all the time, is that when they're doing KoR whitening, and just on average cases, the teeth are getting so white that now you're oftentimes exceeding the patient's expectations. And now every time they walk past the mirror and see themselves, and they're not used to seeing those white teeth, they go, whoa, and so their friends will ask them about it. And now we find that they become infatuated with their teeth. So they're looking in there, and now they're seeing all the spaces, they're seeing all the chips, they're seeing the dark, the amalgam fillings, they're seeing the darker fillings, they're seeing darker crowns, even on the molars, and they don't like it. And that's when they come in and they start asking for optional type cosmetic treatment. And the other thing that the dentists tell us is that when these patients get so excited, that really creates trust in the dentist, and they tend to start listening to the dentist, their recommendations. Oh, you need this gum treatment, or you need endo, or you need whatever. So in general, it's a huge practice builder, because whitening is so great. You don't have to stick anybody with a needle. It doesn't cost them all that much. You don't have to grind on their teeth. Yet when they leave, especially when they get KoR whitening type of results, they are over the moon. And that builds a practice like you can't believe. So yeah, it's for everybody. And we have just at-home kits for average patients. We have all the way up to kits for tetracycline and dentinogenesis imperfecta, and anywhere in between.
Yeah, so if you're a dentist watching this and you've never had a patient who has that kind of reaction, like they do after, say, veneers or a big crown and bridge case, or even sometimes Invisalign, where they're like, every time I see my smile, I don't recognize that it's me because I'm not used to having. If you've never had that kind of result from whitening, it's probably because you haven't tried KoR whitening before. So you owe it to yourself and your patients to give it a try and see what it's all about, because it is truly a different product. Rod, once again, when we wanted to find out what was going on in whitening, we had to reach out to you, the expert. Thanks again for spending some time with us today.
Well, this was fun, Mike. Thank you. I appreciate it.
Well, that will wrap it up for this episode of Product Talk. Thanks again to Dr. Kurthy for spending some time with us. So on behalf of Rod, myself, and all of us here at Inside Dentistry, I want to thank you for your time and your continued commitment to quality dentistry.